Embryology question. So a 29-year-old woman, Gravata 2-0, comes and she's got some concerns about her fetal ultrasound, which show microcephaly, single midline ventricle, and a fused thalamus. The midline cleft is also noted. Okay, so what is this abnormality going to be? So this is going to be chromosome 13, Patau, holoprosencephaly. So whenever in embryological development, you have the prosencephalon. At week 3, the ectoderm is going to thicken and invaginate, and the prosencephalon divides into 2 hemispheres, forming the telencephalon and the diencephalon, which forms the thalamus and the third ventricle. If these are fused, then it's a failure to separate. And a common cause of the failure to separate is going to be trisomy 13, which is Patau. It's the most common chromosomal abnormality associated with it. It's when the sonic hedgehog genes are kind of messed up and the midline development is damaged or compromised. It can be caused by alcohol consumption, retinoid acid exposure, or uncontrolled parental diabetes. So holoprosencephaly, midline facial defects like the cleft lip, seizures, VSD, PDA, polydactyly, omphacil, and ketosplasia, scalp defects. So most fetuses die in utero or shortly after birth. So that is definitely a cause to worry. Now let's talk about some of the other answer choices here because they're super buzzy and important to know. So congenital rubella syndrome, that is caused by the rubella virus, the toga virus. It's a single-stranded RNA. This can be associated with sensorineural hearing loss. And I'll scroll up in a second. You can see some photos of this. So right here, congenital rubella syndrome, microcephaly, PDA, and cataracts are the most important things to know. Rubella virus infects the endothelial cells and disrupts the vascular development, leading to ischemia and tissue necrosis. And you have direct cytopathic effects, so you have organ malformations. And so there's that clinical triad that you need to know: microcephaly and congenital arteritis and PDA, or pulmonary artery stenosis. So you see microcephaly. So we'll scroll down here but you can see some microcephaly. And so now for Zika virus, Zika infection, you can also see some microcephaly. This is a Zika virus is caused by a flavivirus, the single-stranded enveloped virus here. And it's caused by the mosquito sexually transmitted and vertical transmission to the fetus. This is how it spreads here. And basically, it's going to infect the neural progenitor cells and cause apoptosis and disrupted neurogenesis, and it'll diffuse neuronal destruction. So the microcephaly and intracranial calcifications will occur. So you also get this microcephaly, a baby with severe microcephaly here. So that's what you need to know about the Zika. Also, you have it's small head, prominent eyes, and other than that, not too much known. Just know that avoid mosquito bites in the endemic regions and delay pregnancy if you're returning from an endemic area. Okay, now let's talk about maternal lithium use. That should make you think of Epstein's anomaly. So lithium exposure during pregnancy, especially the first trimester, will disrupt neural crest migration and mesodermal development, and that causes abnormal cardiac valve formations. And so in this pathology, you have the tricuspid valve displaced into the right ventricle. You have an atrialized right ventricle here. And that causes right to left shunting via an ASD. And it's associated with different arrhythmias like Wolff-Parkinson-White. Other lithium effects would be hyperthyroidism and goiter, and nephrogenic diabetes insipidus, which blocks ADH's action. So lithium can cause cardiac abnormalities. Okay, so then we have, so that's trisomy 13 we've talked about, and then trisomy 21, that's just Down syndrome. 1 in 700 births. It's a mitotic non-disjunction causing an extra chromosome of 21. It can cause early onset Alzheimer's, cardiac defects, and a cardiac cushion defect, so atrial ventricular septal defects, GI abnormalities like duodenal atresia, the double bubble sign, Hirschsprung's disease as well, aganglionic colon, and also some hematologic risks, increased ALL and AML leukemia. So what you need for that is, first trimester screening is good, and karyotyping is a gold standard for this. So hopefully this is helpful. The big thing you need to know about this one is just that chromosome 13 causes Patau. Patau is associated with holoprosencephaly here. So we'll scroll down here. Scrolling down, holoprosencephaly. So the holoprosencephaly is whenever the failure of the forebrain, the prosencephalon, to divide into the 2 separate hemispheres, around 3 to 4 weeks, associated with sonic hedgehog, and it looks kind of like this. You might see a picture of just a fused kind of membrane there that's underdeveloped. And So that is all you need to know for this question. If it was helpful, like and subscribe.